Welcome to the Skin Quest Clinic Dermatology Podcast. I'm your host, Dr. Praveen Banurkar, consultant dermatologist practicing in Mumbai at Skin Quest Clinic. I thank you for joining today's podcast that covers everything related to skin, hair, and nail diseases. Today, I'm going to be speaking on a very sensitive topic of skin cancer. Melanoma is a type of a skin cancer which we would be discussing about. It is not the most common cancer, but it is one of the most serious as it often spreads very fast. When this happens, it can become very difficult to treat and the outlook may be poor. Risk factors for melanoma include overexposure to the sun, having a very fair skin type, and a family history of melanoma, among others. Receiving an early diagnosis and getting a prompt treatment can improve the outlook for people with melanoma. For this reason, people should keep a track of any changing or growing moles on their body. Using adequate protection against sun exposure can help a person prevent melanoma altogether. Melanoma is a type of skin cancer that occurs when pigment-producing cells called melanocytes mutate and begin to divide uncontrollably. Most pigment cells develop in the skin, and hence melanomas can develop anywhere on the skin, but certain areas are more at risk than others. In men, it is most likely to affect the chest and the back, while in women, the legs and the most common site of the infections. Other common sites of melanoma include the face. However, melanoma can also occur in the eyes and other parts of the body. Melanoma is relatively rare in people with darker skin and in the Asian skin types. So what are the types of melanoma? There are commonly 4 types that are seen. Superficial spreading melanoma, where it tends to spread across the surface of the skin. The nodular melanoma, which is one of the very aggressive types or the most aggressive types of melanoma. Then there is the lentigo maligna melanoma, which tends to develop over a period of time on any particular part of the body and commonly seen in older adults, and the acral lentiginous melanoma, which is of the rarest kind of the melanoma and commonly appears on the palms of the hand, soles of the feet, or under the skin. Since people with darker skin do not typically get other types of melanoma, these tend to be the most common type of melanoma that we see in clinical practice. There are, however, certain risk factors that may contribute to increased risk of skin cancer. These include 5 or more atypical moles, a high number of moles in a particular patient, a high density of freckles and a tendency to develop freckles following exposure to sunlight, the presence of actinic lentigens, also called as age spots, people with light eyes, pale skin that does not tan easily, red colored hair, older age group, a previous organ transplant patient, a family or a personal history of melanoma, and those individuals who have a high sun exposure, particularly if it produces blistering sunburn. One of the most important take-home messages is the ABCD examination, where in simple 5 characteristics a mole can be examined for: A, that is asymmetry of the mole; B, that is border, if it is very irregular in the border; C, that is color, whereas melanomas tend to contain uneven shades or different colors like black, brown, tan, and even red sometimes, or even white or blue in certain cases. D is for diameter, that is a melanoma that causes a sudden change in the size of the mole where the diameter tends to increase. It can be suspected cancer. And E, that is evolving, that is change in the appearance of the mole over a period of a few weeks or months, can indicate skin cancer and needs to be shown to the dermatologist. The treatment of skin cancer is similar to that of the other cancers in the body. This may include surgery, that is remove the lesion, as well as some part of the surrounding non-cancerous tissue to make sure that it goes away 100%. Melanoma, if it covers a larger area of the skin, removal followed by skin grafting may be necessary. If it is spread to the lymph nodes, a lymph node biopsy is a must, and then radiation therapy may be recommended in later stages. Melanoma can metastasize to other organs like the bones and other tissues in the body, and when it spreads, chemotherapy, immunotherapy, or targeted therapy may be required. Now, a small talk on the prevention of melanoma. Avoiding excessive exposure to ultraviolet radiation can reduce the risk of skin cancer. So, you should avoid sunburns, avoid tanning beds, apply sunscreen on certain moles and atypical moles regularly, that is 2 hours, especially after sweating and swimming, to maintain the adequate protection. Keep the children in a shade as much as possible. Avoid too much of sunlight for them and use SPF 50 plus sunscreen. This is in children who have a strong family history of melanoma. So wearing sunscreen is not a reason to spend longer in the sun. People should still take steps to limit sun exposure when required. Now, how is diagnosis for melanoma done? It can be done through use of microscopic or photographic tools called dermatoscopes, which are non-invasive techniques to diagnose melanoma, and the other methods include a skin biopsy. That means we take a small part of the skin and send it to the pathology lab for further staining and examination. To know more details about skin cancer, eczemas, psoriasis, and similar other conditions, tune into the podcast on Spotify, Amazon, or give a shout out to Alexa for the Skincrest Clinic Dermatology podcast. Hope you enjoyed listening and gathered some valuable take-home messages in today's discussion. Thanks for tuning in. For dermatology appointment, send a WhatsApp on 9867 955 944. Take care, stay safe, and stay healthy.